Good afternoon, everyone. We could have all of our panelists start their videos. Wonderful. Okay. Can we all see one another? All right, we're going to go ahead and get started. Welcome, everyone. Welcome to Apart Plus Connected. This discussion will talk about how the COVID-19 virus has impacted New York City residents and deaf people in New York City. I am Brianna D. Giovanni. I am a Gallaudet student and a research intern in the Doctors John S. and Betty J. Schuchman Deaf Documentary Center. So I'm also, my family, I come from a family of deaf New Yorkers, and we're going to be, like I said, talking about COVID-19 and how it has affected New Yorkers. So we're grateful to our 5 New Yorkers, and we also want to thank our major funding support from the National Endowment for the Humanities and CVRS and Purple. We also had support from the Gary S. and Margaret D. Anderson Family Foundation, the Hebrew Association of the Deaf, the Union League of the Deaf, the Cantor Foundation, and many more. So thank you all for your support. So that said, the comments shared here are those of the panelists and are not endorsed by our sponsors. So let's meet our panelists. Our first panelist is from the Bronx. Hi, everyone. I am Roxana Aguiolo, and this is my sign name, and I am from the Dominican Republic. Great, thank you so much. Nice to meet you. And you are from the Bronx and now Queens.
That's correct. My name is Carlos Aponte Salcido Jr., and this is my sign name, and I'm currently here in Queens. That's where I live.
Super, super. We're going to move on to our Brooklyn resident.
Hi, everyone. My name is Marina Fenscheiten, and I'm from Brooklyn. Hello.
Hi, great, excellent. And now our Staten Island resident.
Hi, everyone.
Alex?
I was born in Staten Island. My name is Alexandra Pucciarelli Miller, and I go by Alex for short. Hi, it's good to see everyone.
Awesome. And last but not least, our panelist from Manhattan.
Good afternoon, everyone. I'm Patrice Kramer, and I'm from Manhattan, and this is my name sign. Great to meet you all.
Great. Great to meet all of you. So now we're going to begin our questions. So I'm going to ask you a number of questions, and our panelists can answer or not. This is just a free-flowing conversation and a time to learn from one another. So if we have time left at the end, we'll try to take a few questions from the chat at the bottom of your screen. All right, so our first question is related to changes. So what has changed for you and your local deaf community since the pandemic started? So what has changed? Who would like to begin? Patrice?
Sure, I'll start. I'm thinking about the changes that have happened. Long ago, as a member of the deaf community, there were certain events and activities that we would engage in, such as deaf clubs, opportunities to socialize. But now with technology, things are different. We're texting each other on video chat. We socialize differently. And yet again, I've noticed that, our social distancing, almost reminds me of what happened when we had those older days we were social distancing until we got together in the clubs and the different tournaments and events. And now, particularly in my community, when it comes to, deaf organizations, we would always meet and plan workshops. We would often event plan, for example, conferences or tournaments and fundraising activities and so forth. But I don't really see that happening now. We still remain in touch. However, we don't physically interact with one another as we once did. So that's one change I've noticed. And another change in particular is Zoom. And this has become our new norm for how we connect.
Absolutely, it's become the new norm. So Carlos first.
Well, I work in the School for the Deaf here in New York City. And we serve students from 0 to 21 years of age. And when it comes to our student population, they in total speak 21 different languages. So now with everyone, remote and staying at home, a question is, how can we provide equitable access for all students, not only just for deaf students, but those that are deafblind, as well as deaf with additional disabilities? We don't really have measures in place to provide access. And this is creating a huge impact, not only in the deaf community nationally when it comes to education, but more so here in New York City. We're really taking a look at what it is we have at our disposal, how we can contact our students as well as their families and ensure that there's communication happening as far as what resources are being used. As educators, we truly have to screen, that certain programs are effective and translatable and accessible, and that has a profound impact. That's one example of a huge impact that coronavirus is having on me as an educator.
Absolutely. Roxana? Yes, so in the Bronx, we often have face-to-face activities, really monthly activities, where we all come together, whether it's at the bar or wherever it may be. And so now that COVID-19 hit, we aren't doing that anymore. We're socializing through Zoom, and so it's very, very different for all of us. Yes, I would agree. Who else would like to say anything? So Marina first, or Alex first, and then Marina.
I'd like to point out, as someone who has a deaf club here in Staten Island, and it's ironic that here in Staten Island, people want us to open the club again, and we're getting those asks. People are feeling isolated and lonely, and they're longing for that socialization. And we're happy to do so as long as they want us to do so with masks and be able to play games and such, but we're prioritizing health right now. And because we have a center for senior citizens and they are high risk, we had a 4-time-a-month event. And so we decided that we would establish a VP conference center. And most of them don't have Facebook or other social media sources to be able to get information from. So we are sending things out via email, via messages, trying to make sure that we're staying involved in these people's lives and getting together 4 times a month virtually. We can't do so in person yet because of safety, and we know that people are desiring that ability to get together in a physical capacity, but we're trying to make sure that we're being safe above all.
Absolutely. And Marina?
As Alexandra just mentioned, I help run an adult socialization and care program for senior citizens who have additional health issues. And we get together a couple of times a week. Now everyone is quarantined at home, and just like Alex mentioned, we're having the same problem. Some people don't have access to technology. Some people can't figure out how to operate Zoom. And they've got to make calls related to their health on a daily basis. People need to check in and see how they're doing, whether they need shopping done for them or whatever it is that they need. Our clients receive home health care services, and that's been greatly impacted. They're used to people coming to their homes, and now people have gloves and masks and are practicing that social distance. And there are clients out there who...
I'm sorry, Marina, you're freezing. If you could go back a sentence, you said you don't want what?
Right. Some people don't want the health aides coming into their homes. They're afraid that they'll catch the virus from home health aides, so they're declining these healthcare services. There are some that are unable to shop for themselves, unable to make their own food. So we're having to provide food delivery services for them. And our office staff are now working from home and having to take a lot of this on, even working harder than they would regularly in the office. And so it's really important right now that we're coordinating medical care services, making sure they get their medicines. If they have doctor's appointments to follow up, they've got to make sure that when they go, everyone's wearing masks and gloves. It's been really impactful. And just like Alex mentioned, everybody misses getting together and they're really wanting us to reopen. And I know that that's been a hardship for everyone.
Yeah, I can see it's impacted education, the medical system so much. And we're creating new ways of really meeting the needs of everyone. So I'm going to move on to the next question now. And the next question is related to our signs. So when COVID-19 hit, have there been American Sign Language signs that have come up? Any pandemic specific signs? Roxana? Yeah, at first people were finger spelling and then this sign came up. So I've seen a lot of that. And Carlos.
In the beginning, for the word quarantine, this is how we signed it. And then a couple of weeks ago, there was an organization, HEARD, who shared some information that the signs we were using for quarantine initially were actually quite triggering to those that were a part of that organization. So as a result, we tried to come up with more appropriate signing, and we came up with this, for example. So those are some new examples of signs. Here's another one. So yeah.
Great, thank you. Anybody else? Any other pandemic specific signs? Patrice?
Well, simply, stay at home. That's how I've seen it communicated. This is another way that I've seen quarantine be signed.
And what about face mask? What are you guys signing for face mask? Yeah, this is a new sign. So we're seeing lots of different signs. And, may not be something we see in the future. So we're going to go on to the next question. Roxana, did you want to add something? Yes, I've seen it spelled COVID-19 as well. Yeah. All right, so now we're going to be talking about changes in our community. So how are you staying connected to the deaf community in this time of seclusion? What kind of technology are you using and how are you staying connected? Patrice?
Well, Zoom for sure. That's really the main way. And for our large community, this is the best way for us to connect visually using sign language. We would have brunch get-togethers, around noontime, and you would bring your favorite dish when we would have brunch together. But having Zoom to access one another has been the best next solution. So technology has really improved leaps and bounds. Texting is also another option, but seeing somebody, seeing their face either through FaceTime or, the different kind of platforms that are available for video chat, those are really instrumental in helping one another stay connected in the deaf community.
Alex, and then Carlos.
Sure. I just love to add to that. I'm noticing with the older population in our deaf community, they really like routine. For example, they like meeting 4 times a month, and there wasn't anything in the month of March, and there was a sense of disconnect. People were feeling lost and unsure of how to communicate with each other. So we were able to host events virtually in April, and people started to feel much better about being able to get together. And so I think that routine, and sticking with it has helped maintain some of that sense of normalcy for our senior citizens. So that's one way.
Absolutely. Carlos?
When it comes to our students, our teachers have actually set up Marco Polo, which is an app, and this is how we sign it. And that means students, families, instructors, we can all see one another. Although it's not live, they have an option where you can view a video that was recorded and sent to you. So it's nice. It's a nice tool to learn sign language. My mother's primary language is American Sign Language. And, anytime there's mass or some church service, they're able to access, through Sorensen interpreting services as, other attendees. Last week, it was Alma de Mujeres, a deaf women's group, and they actually had a dance class, a salsa event, and my mom was able to join. And with Zoom, you can play games, even Family Feud, Drawful. These are some games that some of my members in my family and members of the community have been able to stay connected through these times.
Absolutely. Marina?
Right. So we do have a client who has to stay at a rehab center, not because of COVID-19, but because of the surgery. And then COVID-19 hit, and they've had to quarantine at the rehab center. And that's been difficult because of the nurses and the staffs at the rehab center don't sign. They're wearing PPE at all times. And for a deaf person, there is no communication there. Their sister has been reaching out to us and asking us what we can do. They're depressed. They are unable to communicate. They don't know what people are saying because of the masks. So what we've been thinking of is having one of our staff members help install Sorensen, which is a video phone app on a tablet, getting that ready to go, coordinating it with the rehab center to be able to meet there, because you can't go into the center. So we had to meet a member of their staff, teach them how to use the app and the tablet so that they would know how to help this deaf person in the rehab center. So after that, there was a huge difference. The family learned how to work and reach out to their family member in the rehab center. It's been 5 weeks since COVID-19 hit, and people are just getting more and more creative on what they can do to address these communication challenges. So that's another way to stay connected to the community. It's a lot of trial and error, more so than ever now, especially in that center. We're not able to go and visit people. So it's a lot of phone-based work, and has increased the number of phone calls and reaching out that way to us, but it's a good problem to have.
Patrice?
I also wanted to add to what Marina said, about having to navigate COVID-19. We've got to learn how to navigate this. Reaching out to our family through interpreters, and seeing our relatives' faces through the new feature for Sorensen. It's really nice to be able to see those that we're talking to and to connect with them visually, even though we are communicating through an interpreter. At one point, we weren't able to do that. But now, with our families being able to access one another through this new app, Wavelo, that Sorensen provides, this is really a great tool. And it's nice to be able to see our family members. When we see them, it's a higher sense of kind of happiness, and being able that you're able to connect with them. And this is such a perfect time for this to come up.
Absolutely.
So texting is fine, but, really wondering about how we can see our faces. WAVELLO, Wavelo, has been an incredible tool for us to use.
Yes. And Marina, you wanted to add to that? Sorry, your screen is freezing, Marina. Okay, can you start again?
Our clients can't come to our office So we have to teach the doctor how to use Wavelo, and then how to reach out to the client, because our clients sometimes are not tech savvy. So we're finding that we're having to train both entities. And so when people aren't feeling good, rather than having that resistance to going to the doctor, they can use the Wavelo option. With the technologies we have today, it's made it easier.
I agree. And Roxana, you wanted to add? Yes, it's really a fortunate time because some of us are from hearing families. We don't have deaf family members. And so it's nice to be able to still stay in touch with people. So my daughter actually was able to use Zoom with a group of family members. We were able to use FaceTime and actually chat with one another. So that's been really nice and really important, so that I'm not alone and the only deaf person in this hearing family where I have no communication with my community. So technology is wonderful. Brianna, technology really is a wonderful tool. Does anyone else want to add anything? Okay, great. So Marina was talking about face masks and how that's really impacting the deaf community. And so this next question is about face masks and how they have impacted you and impacted the deaf community. And, you know, how about trying not to touch your face while you're signing, as getting attention changed, all of that. Roxana, yes, it's had a huge impact. It's very odd to see people with face masks. Even, for example, Uber. You know, when I show people that I can't actually hear, I try to show them my phone, and, you know, they're just not used to that. So and I'm not used to it. It's a very odd feeling. You know, I feel very closed in. When I've gone out shopping, it's also very odd. You know, people are keeping their distance, and people may be talking to one another and I don't have any idea. And so when I'm asking questions, I may show people my phone and it's hard to understand their response. So it's really a challenge, and it's very strange times. Alex?
Yeah, I would just love to add that during quarantine, however you choose to sign it, staying at home, we do have to still go out to grocery shop, get essential items, and people are wearing face masks and such when you go in the store. And often I don't even realize people are speaking to me, and I have to then identify that I am deaf. It's really hard. We're in an interesting time period right now where communication access for people who depend on lip reading or oral methods of communication are a little bit lost right now. It's a bit of a challenge, especially because we will likely be wearing masks going forward into the coming years even. And we can't go anywhere right now. The mall, a play, nothing potentially without wearing these masks. So it's really difficult for sure.
Agreed. Patrice?
Yeah, I echo what all of you have shared. When it comes to my situation, I think I'm a pretty good lip reader, but when I'm not able to actually see one's lips, that's a very different story. It's very hard to discern if they're happy or angry or sad. It's very hard to tell. Like, I don't know if I'm bothering other people. It's very hard to read what their reaction is. Especially in the morning when you're passing by folks, it's just a very unnerving and awkward experience. But when it comes to signing, I feel like that's kind of who I am, and I'm used to doing that face to face. And also, speaking of face to face, being able to actually touch your face while signing, it's different. There are certain signs that physically you end up touching your face or the upper part of your body. So I've noticed that there are some face masks that have been created for deaf people. I think could be a good idea, but I'm not necessarily interested in creating my own face mask. So that's where I stand.
Agreed. Marina?
I find myself gesturing quite a bit more now to hearing people. For example, these things, pointing, just to start to prepare people to understand that I'm deaf, using my finger to say, to have someone pause for a minute. I think now people, especially in stores, are setting up social distancing markers so people can stand further apart. More and more stores have that plexiglass covering between you and the individual red cashier or whatever it is. Even at the pharmacy, people who know me will take their mask down and speak to me and then pop it back on. There are pros and cons to that, of course. Some won't write back and forth with me because they don't want to use the pen. They're afraid. So I have to make sure that I bring my own pen and paper, and then they need to have their own pen and paper. So we need to unite a little bit.
Agreed. Patrice?
Well, it's funny, with your iPhone, when you're wearing a mask, your Face ID doesn't work. So I can't even get into my phone when I have my mask on.
Very true.
And I end up having to type my passcode. And, sometimes I'm tempted to really just quickly pull off my mask and, access.
Right. Just like with gloves, using your phone with gloves on is really difficult. Sometimes it doesn't recognize your touch with the gloves on. That's also been a struggle.
Roxanne? Yeah. I actually like to use the iPhone pen, and that makes it a whole lot easier. All right, anything else that anyone wants to add? Okay, great. So again, we're touching on accessibility issues when it comes to the face mask. So I want to talk a little bit more in depth about accessibility. So does anyone want to talk about any barriers that you're facing, any accessibility issues here in this time of coronavirus? Carlos?
Well, with the coronavirus and people staying at home, I think it certainly can have an impact on one's mental health. Staying isolated, being disconnected from others, constantly being in a state of anxiety or worry. For those who have severe, mental illness that may be thinking about harming themselves, one offered treatment, could be going to the hospital for evaluations and having psychiatrists at the hospital. But if you're working with a group of deaf people, there may be a challenge. It used to be that, people didn't want to go to the hospital. And now it seems like a lot of the psychiatrists and ERs are opening up, and we're evaluating students in particular. And the sense is, there are a number of them that actually should be referred to see professional services. And sometimes their family members don't want them to go to the hospital. I think hearing people can have psych evaluations through the phone with mobile apps, but one has to ask, how does that work with deaf people, young adults, children, and adults? And I think, having to address these challenges with folks with disabilities is a question that needs to be asked. There were people from my organization that reached out to Elmhurst Hospital, and we tried to address some of these concerns. And this is a serious issue of accessibility, particularly for deaf people in the New York City area. If they need therapy, what's going to happen? Also, when it comes to deaf therapists, who communicate and communicate fluently in American Sign Language, there's not many available. There's only 2 national organizations that actually provide help and are licensed. But out of the many 50 states, that's not the case.
Marina?
I'd say we're struggling with the same situation here. Our services are long-term care, and some deaf people want to be able to apply for that long-term care through their respective states. But we have to make sure insurance companies require a health assessment interview Nurses used to be able to go to the client's home. It took about 3 hours to get that intake interview done. It's now a phone-based interview, and it has to be a 3-way conference call now. We have a communication facilitator of sorts, which not everybody is accepting of our way of going about this. We have a person who can work with relay on the phone with the nurse, and they facilitate those questions back and forth. The nurse can't see the client, but that's what we have to be able to connect to the deaf person. There is technology available to connect a hearing person to a hearing person, but not a hearing person to a deaf person like that. So we've had to create our own way and our own strategy for doing this, and we need to make a judgment call. And have people, we've made that judgment call now, and we need to have people trust that way of going about things. There could be a better system, but we've put this in place because people were not receiving the services that they need, and this is our temporary solution for now.
Patrice and then Roxana.
So as a deaf interpreter, when it comes to service provision, I have to kind of think about how to do that. I'm not comfortable with the masks, and I feel like, the hospitals wouldn't necessarily give me the best protection. I might not be able to fully access the patient's needs. So if I get the call and I'm asked if I can come in, I'm not necessarily comfortable doing that. It's interesting, having to provide a service, but yet you're met with barriers to even do that.
Right. Roxana? Yeah, absolutely. I have had this experience where I don't have an interpreter and I don't have any accessibility. So around March, I used the train and I got to work where I teach ASL with various clients. And after that, clearly things were happening that day. And when I went to the train in the afternoon, it was a different scene. And I was so confused because I imagine people were, using English and understanding one another. Maybe there were even announcements, and I was so uncomfortable. I didn't know what was going on. It was extremely crowded. And finally, when I got off the train and went home, I was just so disheveled. And I contacted a friend who's an interpreter who I imagine was going to hear, what was happening. And I turned on the TV, but there were no captions. And so then, I finally learned that the coronavirus was basically here. And here I am, I was in this crowded train, and it was just so upsetting. I didn't have any accessibility that whole afternoon, not on the train, not even on the TV, until finally I was able to get the news. And so that had a huge impact on me. On the train, it was so crowded, people everywhere, everyone acting very odd. And so I could have easily been exposed. Luckily, I wasn't. So luckily, I'm safe. Yeah, it's very scary. Alex?
Yeah, I'd just like to mention 2 things. Both the mayor and the governor of New York City, you can watch them kind of battle it out. The mayor, I have to commend for having CDIs and interpreters on the platforms with them anytime that they're having these filmed conferences or these filmed sessions. The governor thinks that the captions are enough, that there's no need for an interpreter. And it's interesting to compare New York State versus New York City. And we're fighting to get an interpreter on stage with these political officials anytime they're making an address. They need to be offering this information. And they're saying that the state needs to provide this on behalf of deaf people for the entire state. So that's one thing that I've really appreciated about New York more than ever, is we really do rally together. And our governor is very supportive of that. We're making that happen during this time. Whereas historically, we may have been just swept under the rug as a community. Now we have more power, we have more voice, and people realize that they do need to provide access for us. New York City also has a citywide call
Alert.
for information, and it comes via text. And you can get that in the languages that you want. The past president and some CDIs and deaf people within New York have a ASL anytime call-in number that you can use. And if you're getting these in English, these alerts and whatever, and you don't understand them, then you have an opportunity to see them in sign language, not just in captions. And the hope is that we'll have all of those announcements that don't already have an interpreter in sign.
That's fantastic. All these creative ways. So Patrice, did you want to say anything?
No, I don't have anything to add.
All right, so there's a lot of barriers to accessibility, and as deaf people, we'll always have to go through these and always have to fight for our rights. So Patrice had mentioned that we're coming up with different ways to keep ourselves safe, you know, PPE, masks. So what other things are you doing to keep yourselves safe other than staying at home? So what else are you doing? Staying 6 feet away. Okay, so Roxana, we'll start with Roxana. Yeah, this is the first time I have ever experienced having to wash my hands so much and having to stay 6 feet apart and having to sign so large to see one another. I'm just not used to this. So making sure that we're all 6 feet apart, wearing masks, wearing gloves, trying to sign while we're wearing gloves. It's just a new situation. Not used to all of that. Okay, Marina?
Yeah, I think it's really been a challenge, most especially to those in the healthcare field. Our healthcare workers and caregivers, we have about 100 or so who are deaf, spread out across New York, the Bronx, Manhattan, Queens. And our deaf clients help our seniors with their day-to-day living needs, cooking, cleaning, etc. So how do we protect those caregivers, make sure that they're taking care of themselves, as well as make sure that our clients are still being taken care of? All the caregivers are using public transportation. So with masks and gloves and everything else, we've had to teach them upon arriving, you have to take your gloves off, put new gloves on, take your mask off, put a new mask on, because you've been outside and you don't want to risk infection to the client. They get slippers once they get to the client's house to be able to put over their shoes. The client will sometimes also use a face mask once the caregiver arrives, if they're feeling uncomfortable or resistant to it. Something else we've done is teach both the caregivers as well as the clients proper hygienic techniques for washing their hands. The staff have been a little bit easier working from home because we are a direct service provider. That's been one of the biggest challenges. And the biggest challenge of all is our deaf blind customers or consumers, because how do we tactily communicate with them right now? We've really struggled to try to find the balance between providing services as well as protecting the individuals who are providing the service. Plus, we've really tried to encourage our clients not to go out and go shopping, have a meal delivery service established, whatever it is, to try to be creative to lessen their likelihood that they need to be out into the public. Maybe we can reduce it to one time a week, or have food and medicine delivered rather than them going out. We're trying to get creative in what we can get delivered. Can you stay home and have your blood drawn? Just to try to mitigate or minimize the amount of exposure that these clients have. Some clients have had their hours cut for work. And we've told them that, if they can, please do so, but some are in a needs-based situation.
Absolutely. Carlos?
As I'm looking in every room in my house, I realize we've got hand sanitizer stacked everywhere, and that's a big change. In addition to that, my husband goes grocery shopping, every week. He'll kind of get the food, and then when he gets home, we'll desanitize all the groceries, and food that we can leave outside, we will for 3 days. When it comes to packages and mail, we're very sensitive to that stuff. And these are some changes that we've got to incorporate on a daily basis. I admit that washing my hands was something that I did, but now I do it far more regularly. And this is really our life now.
Absolutely. Alex?
Just to add to what Carlos was saying, my parents are deaf and senior citizens themselves. And the news talks about those with pre-existing conditions are a more vulnerable population, whereas younger people may be a little bit more resistant to the virus as opposed to seniors. So you're absolutely right. Staying at home, making sure that you change your clothes if you've been outside, making sure you're washing your hands, ordering things to your home as much as possible, making sure that all of the bags and plastic things get left outside and that you're sanitizing your groceries. What's been really driven home to me it's become more of a routine now, right? It's becoming a new norm for us because we can't really think of ourselves. We need to be thinking about those family members who are in the vulnerable population. It's a very challenging time for everyone, for sure.
Roxana? Yeah, so I have a 14-year-old son who, used to shop, but I leave him home and make sure I am the only one who goes shopping, and then I bring it home. So it has become routine. And, I just feel like it's not safe for my son to be out there getting exposed. So March until now, he's been at home, and it has not been easy. Patrice?
In my experience, my children are grown now, but being adults, I haven't seen them for about 8 weeks. My son came to give me something, and I was very excited, but he didn't actually come to my home, come in my home. I had to meet him outside, and it just really felt disheartening because they say home is where the heart is. And my son actually works for MTA as a bus driver. So, he didn't want to potentially risk bringing, coronavirus into my home. And, not being able to see my children, wow, the impact there was certainly felt. I was excited to come down and see him. And I said, you know what, forget all this, let me give you a hug, and I'm happy to see you. And, we check in much more often, and, we're washing our hands all the time. But it's just, it's not as relaxing a time as it used to be. We have to be extra vigilant about keeping our hands clean and wearing masks and constantly having to think about how we're changing our habits. So, what I'm sharing is very similar to what everyone here has shared.
Wow, so touching. And Marina?
My parents actually live 2 blocks from my home. And I'm used to seeing my parents often. They visit me, I visit them, and now we're in the same situation where we're meeting outside, we're exchanging goods. I saw my mother recently, and I just felt so bad. I wasn't even able to give her flowers for Mother's. I thought, do I get her flowers for Mother's Day? What should I do? I'd rather not end up being in a dangerous situation. So I just ended up sending her some pictures. And my daughter is the same way. She is just married and attempting to start a new life and a new home, and she can't get out and travel and see the world. And we are staying in touch, but at the same time, it is a challenge to not have that physical connection, even with your own family members. It's been a challenge, and it gets you in your soft spot right there in the heart.
Yeah, it's so hard not to hug our loved ones. Some of you also were talking about home and the space at home. So I'd like to talk about Obviously some live in houses, others in apartments. So how is your interaction with your neighbors during this time? Maybe if you see them in elevators. Roxana, do you want to start? Yeah, I don't actually hear anything, right? So I don't hear my neighbors. I don't hear any communication that's happening. And I often see, posts thanking others in the building. So I'm on the fourth floor. There's a doctor and a nurse there. And so, there's this nice thank you posting. So that's nice that I was able to see that. But otherwise, I'm not seeing anyone around, and I'm not, of course, hearing any of the news. Patrice?
So the neighbor next door is actually a nurse, and we communicate through text quite often and check in on one another. I was one day walking the dog, and there was a woman the woman I'm referring to is the neighbor, very good person. When we went to vote at the polls, we happened to run into each other, and, we embrace each other. And at the grocery store, we're happy to see one another. But most recently I saw her and I was going to give her a hug, and her body language was completely different than what it's always been. She was very resistant, didn't want to reach out for a hug, and looked like she was in self-protection mode. And I thought about it and I realized, I get it. And with her wearing a mask, it was difficult to make out who she was. And trying to communicate from a distance was a challenge. But we really, didn't communicate. It was very difficult for me. And it was just a simple and short kind of gesture, a hello gesture, and that was it. But to have that communication change, going from being able to kind of embrace and be happy with one another to what we're doing now, it feels slightly cold, and not being able to hang out with other people. New York City is famous for always having things to do and people in droves, but with the social distancing and people wearing masks, it's different. Yeah, I've kind of made it a project to people watch and see who doesn't wear a mask, and it's really hard to find anyone without one. It used to be, when people got dressed for work and would go out with nice clothes, as I people watched, that's what I would see. But now it's just totally different. No one's going out to work. No one's leaving their house. It just really feels depressing. It feels like it's a depressing time right now. And, with all of these businesses and stores also being closed and considered non-essential, it's like a ghost town.
Yeah, so that feeling of being disconnected. Anything else anyone wants to add? Marina?
Yeah, I live in an apartment building and we've got 3 elevator banks, and people have been more respectful of having 1 or 2 people go in at a time and other people waiting. Whereas typically people would hold the door for you, we'd all pack in together. Now they're asking people to wait, just 1 or 2 in the elevators. And so I'm just wondering how this is going to affect people's attitudes. What's their level of patience going to be? Are people going to be holding doors for one another? Are they going to be providing more space awareness? It's interesting.
Very true. Anything else anyone wants to add to that question? Okay, so Marina actually mentioned about spatial awareness, and I agree. And so that leads to the next question. As a deaf person, deaf culture provides some deaf gain. So what has your experience been, and have you noticed anything beneficial related to technology or the physical distance? Have you been able to chat through windows, example? Roxana? Oh, absolutely. We have all the technology available. We can video with one another, and I know the hearing community is now, it's this learning curve for them. They're using FaceTime, they're using video technology, I assume, but we're used to it. So it's been very easy. Marina?
I think the last time that I spoke with my daughter, she was going to stop by my house. And so she pulled up, stayed in her car. We had a full-blown conversation with the window up. I mean, it's different kind of communication now, but it was through the window. And a friend of mine is talking about, as a deaf person, going and visiting people's homes. I don't know, and people taking pictures through windows. People are getting creative I'm seeing a lot of those pictures posted where people are stopping by and visiting and communicating via window. So that's nice to hear.
Absolutely, I've noticed that.
And that's one of the more positives I can think of that's come from this time.
Patrice, did you want to add something to that?
Yeah, when it comes to communicating on paper and having to, write something down and put it up on a window, it's different. When it comes to my vet, for example, we're not allowed to actually enter the clinic. So once I, explain to them what I need, I'm told to wait outside, and, there's no communication in sign language that happens there, but at least having the window allows for communication to happen differently between hearing and deaf people.
Absolutely. Anything anyone else wants to add to that? Okay, great. So I'd like to go ahead and go to some of the questions. So Marina actually talked about the deafblind community, and we have some questions about wanting us to talk more about that. And have you had any experiences in New York with deafblind folks navigating their way through this virus?
It has been incredibly frustrating. Some deafblind individuals still have their own way of communicating with us, the staff, via text. They cannot use the video phone. I'd say we have about 15 deafblind individuals, and out of that 15, maybe 3 have the capacity to text. And so what if an emergency happens or an aide's schedule changes and they need to shift the time that they're supposed to go? We've really hit a roadblock with this, and it's been debilitating.
Alex?
Yes, a few of our members are actually deafblind, and historically they've been overstimulated by the amount of texts and whatever else that hasn't been their preferred mode of communication. Tactile communication has been what they would like to do. Now everything is home-based. People are on their computers all day long trying to communicate. And so what we've tried is 2 hours of video phone a week with an aide or another person who can support them in the same room. They can speak English or not. And just as a check-in, how are you doing? How are you feeling? But I wish we did have a better way of being able to provide access to these individuals without them feeling so isolated at home and so dependent on their technology all day long. These people are feeling very physically disconnected from the world. And while the communication equipment provides access, it definitely still disconnects you from the community.
Marina?
Right. Just to dovetail on that, I don't know what's happening with the deafblind community and whether or not there are some that learn Braille and some don't. Our activities, well, some of our clients have the ability to read Braille, and the caregivers are buying Braille board games, trying to get them, trying to find different forms of Braille or tactile entertainment because they can't go out. So that's one approach that we've been using. There are other deaf people who cannot read Braille. They're deafblind people, and some deafblind have a Braille text or a Braille reader that will convert their texts into Braille. In this type of situation, the deafblind community needs to figure out how to come up with a way to better communicate. The situation may go on into the future, and so if they can't read Braille, if they can't access other forms of communication, what is another way if you cannot have physical contact? Also, in an emergency situation, notifying someone that they're in an emergency, that's a big issue right now in the deafblind community. We need to figure out how to partner with them on and how to plan for the future.
Absolutely. Alex?
TV announcements come out every day. Either the mayor or the governor come out and they have a daily announcement. And that type of information is the transcript is not often uploaded online, and the deafblind community therefore then does not have access to what's going on. And I feel like that is the responsibility of the state to ensure that every address gets a transcript created for it so that the deafblind community can have access to it. So that's the one suggestion that I could think of.
Agreed. Accessibility really needs to improve. So what are your thoughts on Andrew Cuomo, the governor, his daily messaging about the virus? So in the past, he didn't have a CDI. How do you all feel about that? And what is your reaction to that? Patrice, I see your reaction.
It's very good. I think it's a tricky question, and I'm not exactly sure how I feel, but when I watch the mayor with interpreters present, it does make me feel like, it's nice that they think of and have respect for deaf people. And as far as the governor providing interpreters, I honestly feel like that's something that should happen. But really, I don't know. For me, as I'm watching the captions, to be quite honest, I'm not necessarily interested in watching a lot of these news reports because it gets so depressing over time. Just constantly breaking news, being interruptive of the different programs, and just having these statistics and numbers spewed out 2 or 3 times a day. I'm a bit over that. But as far as the mayor providing interpreters, I think that's nice. As far as the interpreters in particular, I don't necessarily have strong feelings about them. But I think that they should be there. I think there's been 3 or 4 people who've tried to sue, and the judge reported that interpreters should be provided. So, kudos for winning that battle. But for me, I guess I'm a little bit indifferent. I don't have a strong feeling about it.
Understood. Carlos?
So I'd say that I'm privileged and I have the ability to read, and I'm able to read English text. I noticed that initially my dad would often ask me what is being said. And I realized, right, my dad is deaf, just like Alexandria, and relies on ASL for communication. And when the mayor had his press conference, I can see that my dad was able to access the message and hit through the interpreter. So even though I have access, having a signing person on screen is incredibly important. That gives access to members of the deaf community as well. And if we're talking about other members of the deaf community, like deafblind, that's another challenge, but at least having interpreters there for visual access.
Absolutely. Marina?
I actually provided a training for NYPD and 911 emergency systems. And they didn't realize the diversity of deaf people in the deaf community and the variances in language use. We have everyone from people with competent English skills to people who cannot read and write, and a variety of mixed languages within our community. And so we need to figure out how to communicate on a daily basis. Yes, there are deaf people who use sign language, and that is a percentage of the New York population, and there's no excuse. They need to have that level of language access because we are a part of this population. Regardless of deaf people's fluency in written English, you can't depend on that as a means of communication. You need to provide equitable access.
I would agree. Any other additions to this question? Okay, great. So 30 years from now, what do you think you all will remember from this time period?
Everyone coming together.
Yeah.
Our effort to unify our resources. This has really forced us to become much more creative. This is an introspective time to understand what service provision looks like and be able to be creative on how we can provide services in the future. And maybe things that we didn't appreciate in the past, like VRI in hospitals, I think that that's been a source of contention in our community, and now there's a real paradigm shift, and we're going to be dependent on VRI as another means of communication access. So we're really starting to reevaluate a lot of things, and I think in 30 years, we're going to look back on this time and think that we've made it through, and we've been able to survive through this time.
I would agree. Carlos?
Yeah, this is going to be heavy, so consider this a trigger warning. I think with what's happening today, it's really forced us to take a look at what people with privilege have and what marginalized people don't have. So for example, 2 weeks, New York City, it was beautiful out. There were two neighborhoods in the city, one where there was mostly white people, some wearing masks, some without masks, and no incidents happened. And then another neighborhood, strong Black and brown presence, some folks there, and we saw police officers being much more aggressive. Racism happens, ableism happens, autism happens, a lot of inequitable services happening. And my hope is that while we try to figure out how it is we can move forward, we need to take a look at oppression. We need to explore what is not just, and what our community needs and how we can better work together. So that's what I like to remember, but to look at that, look at the ugly and see what needs to be fixed, and be willing to roll up our sleeves for the betterment of our community.
Absolutely. So unfortunately, time has run out. So short closing comments from each of you. Roxana, would you like to begin? Yeah, I just want to make sure that everyone knows, this is such an important historical moment, really, from March 15th till now. It's almost 50 days. And it's so important that you keep in touch with your loved ones. For me, of course, it's my children. And, whoever your close ones are, share with your family, stay in touch. It's just so important. Alex?
I think that two things that I wanted to commit to is I wanted to remind everyone that accessibility is important for us. Please keep fighting for your right to have access. Do not get complacent and think that someone else can do these things for you. You are involved in your own rights process. The other thing that I wanted to mention was be more empathetic towards people. I can promise you, if you are, everyone has been impacted by COVID. You know someone who has lost a friend or family member to this disease. So be more empathetic to everyone in the community now.
Absolutely, I agree. Okay, so I wish we could talk more. We do have so much to talk about. This has been so heartwarming, and just to talk about how the deaf community has been impacted. And so thank you so much for sharing your experiences. Stay strong, stay positive, stay healthy.
Stay safe and stay healthy.
Absolutely. Thank you so much. Now everyone can turn off their videos. Bye-bye. Bye-bye. Bye, everyone.